And according to the CDC, more than 21 million people in the U.S. have been infected by COVID-19, including myself. It started on my day off with a runny nose, and what I thought was a sinus infection turned out to be COVID-19. I want to offer you all some tips so that you can avoid making that same mistake. Acadiana's regional medical director says it's really hard to tell the difference between COVID-19 and a sinus infection because they're both upper respiratory infections.
Symptoms of sinus infection or just irritants or again very similar to COVID. So stuffy nose, runny nose, headache, dry cough. Those can be symptoms of a lot of things. And so unfortunately this time of the year, people really with those symptoms need to be tested.
Dr. Stefanski says the one symptom that's different between COVID and a sinus infection is the loss of taste or smell. Even then, she says you should still get tested just to be sure.
Considering the high rate of infection that we've got in this community and in this state and frankly around the country, it is very likely that if you've got headache, a stuffy nose, a dry cough, body aches, that it could be COVID.
Dr. Stefanski says you can catch COVID with human interaction, but catching a sinus infection depends on how your sinuses drain. She says see your primary care doctor.
They're going to rule out, based on your symptoms, maybe strep throat or the flu in addition to COVID. And if they rule everything else out and then and all is negative and it's a sinus infection, then likely, based on how long you've had those symptoms, they will very likely treat you with antibiotics.
People also tend to mistake COVID for a sinus infection when they experience burning inside of their nostrils. He says at the end of the day, there is a test for COVID-19, but there isn't one for a sinus infection, which is why she urges you to get tested.